Well, hello, everyone. Thank you very much for joining us today for the first iteration of a new interview series for the International Society for Frontotemporal Dementias, or ISFTD. My name is Chloe, and Charlotte is here too, and we're both volunteer for the ISFTD. And today it's a great pleasure for us to introduce Dr. Annakaisa Haapasalo and Dr. Eino Solje, who are both from the University of Eastern Finland in Kuopio, Finland. So we'll be discussing today their paper they recently published in the Journal of Neurology, Neurosurgery, and Psychiatry, which is titled GFAP as a Biomarker in Frontotemporal Dementia and Primary Psychiatric Disorders, Diagnostic and Prognostic Performance. Dr. Haapasalo is an associate professor and the leader of the Molecular Neurodegeneration research group at the AI Virtanen Institute for Molecular Sciences. In this collaborative study, she was the one who shared her knowledge of blood biomarkers in the context of neurodegenerative disease. The study was a joint effort with Dr. Eino Solje, an adjunct professor who provided his expertise on the clinical and genetic aspects of frontotemporal lobar degeneration, FTLD. As a clinician, Dr. Solje is very familiar with the core issue addressed in this paper, that is the difficulty of establishing an accurate diagnosis when symptoms are consistent with FTLD pathology are observed in patients. So Charlotte, if you want to introduce the paper.
Yeah, yes, indeed. We know that even compared to other neurodegenerative diseases, FTLD disorders have very high rates of misdiagnosis, and this can lead to very dire consequences for the patients and their families. Among FTD clinical subtypes, it's the behavioral variant of FTD, so BV-FTD, that is the most prone to misdiagnosis. Its clinical presentation often includes apathy, disinhibition, personality changes, etc. And it overlaps with the symptomatology of several primary psychiatric disorders, such as major depressive disorder or bipolar disorder. While there is ongoing work to identify reliable clinical features that would differentiate FTD from primary psychiatric disorders, combining this knowledge with fluid-based biomarkers has the potential to greatly increase the certainty of the diagnosis. In this work, Dr. Haapasalo and Dr. Solje have just investigated the levels of marker of astrocytic damage known as glial fibrillary acidic protein, or GFAP. In a group of 107 FTD patients and 44 primary psychiatric disease patients, they found that the former had elevated serum levels of GFAP. The authors observed a similar pattern using whole blood samples in a smaller cohort, in which it was confirmed that FTLD patients had elevated levels of GFAP compared to healthy controls too. The optimal levels of discrimination between the two patient groups was when the serum GFAP measures were combined with another non-invasive blood biomarker of neurodegeneration known as neurofilament light chain. Both biomarkers were assessed using the highly sensitive single molecule array SIMOA technology. In terms of clinical outcomes, serum GFAP levels were also associated with shorter survival time of FTD patients.
Thank you for introducing the paper, Charlotte. So yeah, now we're gonna start with questions. So first of all, we'll start with Dr. Solje. We were wondering sort of what brought you to research FTLD and that specific topic of misdiagnosis in FTLD.
Thank you. Actually, I started my research in the field of FTLD as in a little bit accidentally. I made my MD thesis in the group of molecular genetics in Alzheimer's disease. And after the preparation of my thesis, I concentrated on clinical aspects. But however, I was attracted on the research of neurodegenerative disorders. And approximately 10 years ago, Professor Anne was establishing FTLD research group in Kuopio, and I contacted her. And then I performed my PhD studies and dissertation under her guidance, and I concentrated on clinical aspects, especially in the C9orf72 repeat expansion carriers that we have quite a many in Finland. And today I've academically focused on characterizing clinical aspects in early FTD and validating new biomarkers for the diagnostics, and especially the differential diagnostics between late onset psychiatric illnesses and FTD has remained quite challenging, and I hope we could now provide some instruments aiding this demanding work.
Thank you, Dr. Solje. Dr. Haapasalo, could you comment on differences in blood GFAP between the three groups, so healthy controls, FTLD, and primary psychiatric disorders?
Yes, thank you. So in the paper, we described that the blood GFAP levels were significantly higher in the FTLD patients compared to, first of all, the healthy controls, but also compared to the patients with primary psychiatric disorders. So these findings suggest that the GFAP measurements might provide actually useful blood-based biomarker for the differential diagnostics of these two disease groups, which stated often show overlapping clinical symptoms. And this really is a challenge in the daily clinical work, as the overlap of these symptoms makes the differential diagnosis of FTLD and psychiatric disorders quite difficult, especially in the early phases of the disease. So we believe that the difference between these two disease groups actually reflects the fact that FTLD is characterized by neurodegeneration in the brain, which is associated with astrocytic activation and astrogliosis, while there's usually no major neurodegeneration in the brain of patients with psychiatric disorders. And it has been previously shown that astrocytic activation and astrogliosis lead to upregulated levels of GFAP. And so we think that our findings in this paper are related to the elevated blood GFAP levels indicate these pathophysiological processes in the brain of FTLD patients.
Thank you. That's very interesting. So back to Dr. Solje now. Could you please elaborate on the significance of this study, particularly when it comes to like the diagnosis of BVFTD, like the behavior variant of FTLD, since it's the most challenging one?
Yes, today we do not have particular blood sample or CSF-based specific dynamic biomarkers for the CNR72 repeat expansion associated FTD. In addition, sporadic cases lack a valid biomarker for differential diagnostics. And now we believe that GFAP from peripheral samples may provide a practical tool for differentiating FTD and primary psychiatric disorders, as well as for discriminating patients with potential early FTD from healthy controls, which is also sometimes quite challenging, as you know, in daily clinical work. In addition, we could see that the best discrimination tool was identified when we combined GFAP from serum and serum neurofilament light chain, which provided quite good AUC value 0.89.
Okay, great, thank you. Dr. Haapasalo, could you have any recommendations on how we can combine biomarkers and clinical data? Like, could your research, for example, be used to create guidelines towards the prevention of misdiagnosis of BVFTD and primary psychiatric disorders?
So, of course, I am not a clinician myself, but I believe that that as these new specific biomarkers emerge in the field, so after validation, they will provide additional and very useful tools for a more specific and early correct diagnosis of these diseases. So combining the biomarker data together with detailed clinical data will further help in making this early correct diagnosis. And I think it is possible that new biomarker findings, of course, after thorough validation in larger patient cohorts, could eventually lead to, for example, updated diagnostic guidelines in the future for these diseases.
No, thank you. And okay, so Dr. Solje again. What are you planning for the future now? Both groups, I guess, may plan future collaborations. Do you have any other projects also related to FTLD? Do you plan on trying new biomarkers?
Yes, we will further concentrate on identifying and validating practical clinical biomarkers for FTD. And I hope that based on the new biomarkers, we could identify accurately early and prodromal FTD cases and further proceed on mechanism understanding and characterizing early pathophysiological aspects in these diseases. We also aim to better understand prodromal features linked to FTD, and especially in CNR72 repeat expansion carriers. And moreover, new biomarkers and improved understanding of early clinical features and phenotypes in FTD will also provide a suitable basis for future clinical trials.
Okay, then finally, on a different topic, how do you celebrate the publication of a manuscript?
Would you, Annakaisa, start?
Oh, yeah. So of course, during the COVID pandemic, it has prevented us of having only very few face-to-face celebrations recently. But of course, when we get a chance, we will get together in, for example, lab meetings that we have regularly or otherwise, and have some coffee and cake and perhaps a toast to celebrate the new publication together. So at least this is my hope that we could do actually soon together with Dr. Solje's team.
Yes, sharing findings also in Twitter and having a glass of some sparkling. I think it's quite a nice way to celebrate public publications.
Okay. Well, thank you very much to both of you. We are very much looking forward to your next studies. So thank you and goodbye.
Thank you very much. It was our pleasure. Thanks.